Alright, pre-meds. This presentation is by the two pre-dents in the class, Maddie, Tewey, and Jesse Maun. So we're going to talk to you about private dental practices. The dental field as a whole is largely run by private practices, which are offices owned by either one or a small group of dentists, who not only act as the healthcare provider, but as the business owner. Independence has been a tradition in the dental field. In the 1980s, more than 95% of dentists were solo practitioners who ran their own practice. This can be an extremely attractive business and career option since it allows the dentist themselves to have control over every aspect of their practice and operate independently. However, in recent years, private practices have decreased in number in favor of corporate managed practices. Despite this trend, private practice is still the most prevalent business model in the dental field. Pictured on the left is one example of a private practice, Dr. Lapazina's office in Bel Air, Maryland. So who works at a private dental practice? Of course, there's the providers, and obviously the dentist of the practice, who's typically the owner and oversees all patient care and usually has a strong influence on the business side of the practice as well. However, a single person is not enough to run a business, so one or a few dentists could not possibly run a practice on their own. There are also mid-level providers such as dental assistants who may take x-rays, impressions, and do other tasks the dentists don't have time for, dental hygienists who help in routine teeth cleaning and sometimes assist in procedures, and dental technicians who help make prosthetics, bridges, and crowns. Administrative staff is also required to keep a practice a successful business. There's typically an office manager, accounting and billing staff to manage company funds, and receptionists who interact with patients and handle paperwork. On the left is a picture of the Scarsdale Pediatric Dental staff in New York, with their multiple mid-level providers and administrative staff. Thanks to the work of many, private dental practices are both quality care centers and thriving businesses. Since the vast majority of dental practices are private, it makes sense that the vast majority of patients would go to a private practice. Because of how common they are, private dentists see patients in all demographics. Most dental patients tend to have insurance, since uninsured patients avoid seeking dental care in the first place since they feel it's probably not necessary and they need to save the money. Private practices encompass all types of dental services, from regular checkups and cleaning to specialist services. The specific demographics a practice sees are based on its location, and the services it provides are based on the educational background of the providers. Patients tend to choose private dental practices because of their personal touch to customer service and care. In a private practice, as opposed to a clinic, the same dentist tends to see the same patients repeatedly, allowing for continuity of care as well as a more familiar relationship.
Have you ever wondered how many of the dentists in the United States are practicing in private practice? Out of the 230,000 dentists working in the United States, 72% are in private practice. This is 165,000, which shows that a large proportion of dentists are working in private practice. Looking at the figure above, in blue, you can see that 80% of dentists are general dentists, while 20% of dentists are specialty dentists. Of these 20% in specialties, you can look at the breakdown figure of specialties to see that the largest proportion of specialties are orthodontics and oral maxillary facial specialists, while the smallest proportion of these specialties are in public health and pathology. As touched upon on previous slides, a private dental practice is owned by the dentist or a small group of dentists. The Agnini Family Dental Practice is a small private practice locally owned by 4 dentists: Dr. Michael Agnini, Dr. Andrew Agnini, Dr. Mohammed Bhatti, and Dr. Donald Vand, here in Lakeland. Another locally owned private practice is owned by Dr. Sarai, which is called Paul Sarai's Family Dentistry and is privately owned by him. The two figures in this slide are the icons of their practice. What are some of the benefits and limitations of owning your own private dental practice? The major benefit of a private dental practice is full autonomy over practices, techniques, and your work schedule. You are free to focus your practice on certain patient groups, such as children, and decide to offer certain techniques, such as sedentary dentistry or dental implants. Like any business, you can set the schedule and decide when to take time off. Unfortunately, full autonomy also requires that you are in charge of the business aspects of dentistry. As an owner, you are in charge of hiring, firing DAs, hygienists, and office staff. Since your employees and overhead must be paid, your salary varies based on the amounts of patients you see and the types of procedures that you use. As a business, you are in charge of filing insurance. Upon graduation from dental school, you must weigh the pros and cons of private practice and corporate dentistry to choose which one you will go into.
So that's private dental practice in a nutshell. Thanks so much for listening to our presentation.